Hey everyone, welcome back to the channel. Today we'll be talking about a basic topic from the histology section, that is epithelium, and we'll be talking about the definition, the classification and clinical importance. So let's get started. So epithelium is basically an avascular lining of the body, and it lines the internal surface of the body cavities and also the external surface of the body. Epithelium also forms the secretory portion of the glands and also their ducts. In addition, it also does some specialized functions like smell, taste and vision. So basically it has three principal characteristics. Firstly, the cells are quite attached with each other. They are attached by cell junctions, right? Number two, they exhibit functional and morphological polarity. And the third one is the underlying surface basal cells are attached to a basement layer, which is a non-cellular protein layer, right? Coming to the classification of epithelium, the traditional classification is very descriptive. It is defined by number of cells and the shape of the cells. So the terminology reflects the shape but not the function. So it is described as first simple, that is only having only one layer of cell, and then stratified, that means there are two layers. Basically the individual cells can be described according to their shape, like squamous cells are known as squamous because they have flat cells. Next, cuboid, that means their width and height both are same, and then columnar, that means the width is shorter than the height. You should remember one thing, that the cells in the surface of the epithelia determines the name of the particular epithelium. Like in stratified squamous epithelium, the layers are multiple, right, or more than one, but the surface layer of the cells determine the type of the epithelium. In some instances, a third factor can be added to the classification system. Like in some simple columnar epithelia, they are named as simple columnar ciliated epithelium because of presence of cilia in the topmost layer. The same principle applies in stratified squamous epithelium, that is whether they are keratinized or non-keratinized by presence of keratin tissue on the surface layer of the epithelia. Now there are two special categories of epithelium, it is pseudostratified and transitional epithelium. Pseudostratified means there is only one layer of cells, but it seems like there are multiple layers because the basal layer cells or the cells that are attached in the basement layer doesn't reach to the top, and some cells are taller and reach to the top, so it gives an appearance of two layer cells or multiple layer cells, right? Next is transitional epithelium, that is also known as urothelium. In simple terms, the epithelium that lines the lower urinary tract extending from the minor calyces of the kidney down to the proximal part of the urethra. Urothelium is stratified epithelium, and it has specific morphological characteristics that allows it to distend. Certain special names are given to epithelium in certain special locations, such as endothelium, that is the lining of the blood vessel and lymphatics, the endocardium that lines the larger vessels and atria of the heart, mesothelium lines the closed cavities of the body, and the pleural cavities and pericardial cavities. So what are the functions of epithelium? First is secretion, like the columnar epithelium in the stomach and gastric glands. Next is absorption, like columnar epithelium in the intestine, large intestine, small intestine, proximal convoluted tubule, right? Next is transportation, like motile cilia help in transportation of various products in hollow organs. Next is protection, like stratified squamous epithelium present in the skin protects us from the external environment, and transitional epithelium that is present in the urinary bladder protects the urinary bladder and helps it to expand. It has receptor function, like the external stimulus from the environment, like taste buds, then the skin for touch sensations, and retina for vision. So let's see the classification of epithelium. Firstly, we have simple squamous epithelium found in vascular system body cavities, Bowman's capsules in kidney, respiratory spaces in lungs. These are basically helps in exchange, barrier in the central nervous system, and also lubrication. Next is simple cuboidal epithelium. These are present in small ducts of exocrine glands, surface of ovary, that is germinal epithelium, kidney tubules, thyroid follicles. These help in absorption, conduct, barrier, secretion. Next is simple columnar. These are in small intestine and colon, stomach lining and gastric glands, gallbladder. They help in absorption and secretion. Next is pseudostratified. They are present in trachea and bronchial tree, ductus deferens, efferent ductules of epididymis. They help in secretion, absorption and conduit. Next we have stratified squamous epithelium. They are present in epidermis, that is skin, over oral cavity and esophagus and vagina. They help as barrier protection. Next is stratified cuboidal. These are present in sweat glands, ducts, large ducts of exocrine glands, anorectal junctions. They help in as a barrier and conduit. Next is stratified columnar, largest ducts of exocrine glands, anorectal junctions. They help in barrier and conduit. Next we have transitional epithelium or urothelium. They are present in renal calyces, ureters, bladder and urethra. They have distensible property and help as a barrier system. Glands are also epithelial in origin based on their secretion types. Firstly, exocrine glands with ducts, example salivary glands, and endocrine glands without ducts like thyroid and pituitary gland. Next is mixed glands. Next is mixed gland that has both exocrine and endocrine part. Example is pancreas. The clinical anatomy section has epithelial metaplasia. This means reversible conversion of one mature epithelial type to another mature epithelial type. Metaplasia is generally an adaptive response to stress, chronic inflammation or other stimuli which are abnormal. The most common epithelial metaplasia is columnar to squamous metaplasia. In this, the columnar epithelium is converted to squamous epithelium. Like in prolonged exposure of cigarette smoking, the pseudostratified epithelium of the respiratory tract is converted to squamous epithelium. When metaplasia is diagnosed, the effort should be made on removal of the abnormal stimulus. Example, cessation of smoking, eradication of infectious agents, and monitoring of the metaplasia site to ensure that there is no cancer production present. So this was the video on epithelium. I have made a short video because the most important things to make you understand was the classification and few things here and there. Please comment down if you need any help or any notes related to this topic. Thank you so much and see you again.